I've always wanted to do the video on the no burn technique, so I'm here in Austin, Texas with the Austin Love Doctor, Emily Porter, and we just drew 2 kits of 30. And what I'm going to do, I'm going to do one with standard PRP, and I'm going to do the other one with the no burn technique. So what I'll do is I'll start out with the standard. So what I'm going to do is I would take this one here, and if we look at it, we're at about 14 cc's of plasma. And so we're going to do an O shot, so we're going to need 5 cc's. So what I'm going to do is out of the 14, I'm just going to go ahead here and draw off 9. And if I draw off the 9, and then I'll just confirm that we are at 5. So we have just enough for the O shot. This is PPP, we're going to throw this away. This we're going to reconstitute the platelets, growth factors, and cytokines that are on the bottom until we make sure we get all the sediment off the bottom. We'll pull this up into a 5 cc syringe. And we have 5 cc's of PRP. We started out with 30 cc's of blood. We end up with 5. So we are at 6 times concentration of platelets to whole blood, and we have perfect PRP using regular standard technique to do the O shot. Now we have a second 30 cc kit. We're going to look, and we have about 13 cc's of plasma. So what we'll do is we'll take another syringe. Find another clean one here. So we have 13, we need 5 to do a face. So we're going to remove 8. So I'm going to pull up here, take 8 cc's off, which is right there. Actually, no, because we're doing the no burn. So that's where I would normally stop. So we have 8 cc's taken off, we're at 5. But I don't want this to burn. So now what I'm going to do is I'm going to actually pull up. There's a little crook on the bottom of this tube. And I'll bring this up so you can see it. There's a little crook on the bottom. So what I've just done is I've taken it now down to just a cc and a half. So all I have in this, so this is all PPP. So we'll get rid of that. We have a cc and a half of plasma with all the growth factors and cytokines at the bottom. What we've essentially done by taking all the plasma off is that we've also removed all the anticoagulant. The anticoagulant is what lowers the pH and causes the burn. In this syringe, I know I have a cc and a half in here. In this syringe, I have just 3.5 cc's of bacteriostatic saline. I'm going to go ahead and screw that on. I'm going to add the 3.5 cc's. And now what I've just done is I just reconstituted all the growth factors, cytokines, platelets that are in this tube with saline. So we still have the same concentration because now we still have 5 cc's in here. So we still have 5 out of 30. So we're at 6 times concentration, but all the anticoagulant, all the sodium citrate has been removed. So now the pH of this is going to be closer to 7.2. So now we're not going to get the burn that we would normally get with regular PRP. And what I'll do is I'll pull this up. I just want to show you real quick. If we look at this, they look exactly the same color. So they're exactly the same. I used 2 different syringes because I didn't want to mix them up. So this is the no burn. This is the regular standard. Hey everybody, this is the second part of our looking at the no burn and burn technique for the face. So we've decided to do half of the face with the no burn PRP and half the face with the regular PRP. The 2 injectors do not know which syringe they have, and the patient does not know which side is the no burn and which side is the regular. So we want to prove that the no burn technique truly works. So we'll go from here and we'll go to the injectors that are doing the PRP half of the vampire facelift.
Real quick. You drew off the half, so there was 2 to start.
Mm-hmm. pretty sure I can already tell which
Uh-huh.
side was the burn side. And I don't know, I'll be curious if I'm right.
Okay.
These
know if
injectors
you're right.
are both equally qualified, so.
You don't need to go in that deep. You barely have the bevel on. That'll work.
Oh, you mean depth-wise, but I'm at the right.
Yeah.
All right.
So-
Did you notice a significant difference on one side compared to the other?
Significantly less burning and discomfort. Still some, but less. This is significantly more.
Yep. So we definitely proved it. So the left side was the
No burn.
no burn, and the right side was the burn technique.
If you were to rate this from 0 to 10 on one side of burn, what would you say this
I'd
is?
say 4 or 5 and 10.
There you go.
Wow.
Wow.
So there's the proof.
This one's still lasting. This one is almost gone. This one's still just fired up.
And we've never done this before.
We've never done this. I don't know anybody that's actually ever done it to look at, if it truly works or not. I mean, we've shot videos on how to process the no burn, but we've never done a side-to-side injection to see if there was really truly difference. So
Thank Tori, she's brave, and now she knows what protocol
Yes.
she's going to do.
there you go.
I was like,
Yeah.
So
now she knows what Scott went through.
yeah, so PRP with the no burn technique using the PureSpin centrifuge. So if anybody has any questions,
fine.
please reach out to me. And as always, stay safe. Bye.